I would like to put the first question to Dr. Wilona. What are the main causes of anxiety and depression? And it is understood that, depression is actually the #1 cause of suicide. So would you like to throw some light on this?
Thank you, Sonali. Thank you so much for that question. It is a question that I often get in the OPD when there is a patient sitting in front of me talking about the symptoms that they are experiencing. And if I have made a diagnosis of either anxiety or depression or a mixed picture, very often the patient or the family member will reach out and ask, "Ye kyun hua? Why has this happened to me?" So it's a very common thought that there must be some trigger or one particular incident that could have caused the depression or anxiety. And very often they look at some life event that could have triggered it. Okay. In psychiatry, we look at every psychological and psychiatric disorder being considered as having a biopsychosocial origin. So there is biology behind it, there is also psychological factors behind it, and there are social factors that contribute to the onset of the illness. So for both anxiety and depression, we feel that there could be a underlying genetic vulnerability that could have predisposed the person to the onset of the illness. There could be a number of biological factors such as there could be neurotransmitter abnormalities that the patient is struggling with. In anxiety and depression, the most commonly implicated neurotransmitter is serotonin. So it's not uncommon for a lot of patients to come and ask me that ये serotonin कम होने के वजह से हो रहा है क्या? So we definitely have awareness to that extent now, especially in the urban practice that I am based out of. But it is for me a mix of all these factors that are coming together. So it could be a person who has the genetic vulnerability, who after facing a number of stressors or facing a significant stressor in their life has developed a change in the neurochemical balance in their brain and now is struggling with coping with that imbalance that has been created. So sometimes personality factors that the patient comes with, what kind of coping strategy that they use, the kind of social support that they have, all of this contributes towards creating the illness. And one of the reasons why we use such a multi-pronged approach in treatment, that is, we use medicines, we use psychotherapy, where there is a role for a medical social worker, we involve the medical social worker. In cases of children, we also use other therapies that are available. So the whole basis of this is because the causation is only multifactorial. So for both anxiety and depression, I would like to emphasize that the cause is multifactorial. It could be that at a certain point in life, all of these factors are coming together and creating that milieu that creates all the symptoms that make it possible for us to make the diagnosis at that point of time. Yeah. Depression is one of the leading causes of suicide. When you look at the number of people who talk about the thought that things are going really bad, I feel that there is no point in continuing, and I feel really hopeless or worthless. If all of this could end and I could just die, it would be so much better. Yeah, sometimes even going into the active thought of I wish I could do something that would end all of this. We hear these thoughts expressed very commonly. And a lot of times people and family members around the person hear the thought but think that they won't really act on it. For me, the thought itself suggests that there needs to be some action taken, and if possible, some serious action that is taken.
Right.
Because given that most patients who complete suicides have had a history of depression or severe anxiety or could have had some other psychiatric diagnosis in the past, these are indicators that the person could be struggling with something and has finally reached that point where they feel that it is hopeless and there is really no point in continuing. So I would say depression is definitely one of the preventable causes of suicide, and we should work towards identifying areas where we can support and help patients who struggle with depression.